My brother Wallace was out in Texas and he was reading Ebony magazine and he saw where they talked about this study. So he called my dad and he says, "Daddy, do you know anything about this study?" He says, "No, I don't remember anything about any study."
Welcome to Archival. I'm your host, Juanita Tolliver, and today we continue our journey through family archives and the U.S. Public Health Service study of untreated syphilis at Tuskegee. And I'm taking a different approach because I'm looking through the lens of the participants, rather the unknowing subjects of the study. I'll be honest with you, the word participant became more and more distorted throughout my research because it implies an awareness and an intentional willingness that simply wasn't there. And the archives merely featured the men as numbers, specimens in jars, or redacted names in documents, not as the full, whole human beings that they were. So I'm excited to explore who the men were as people, what they meant to their families and their communities, and how they lived their lives. This is an exploration of their humanity. Diana Ross dazzled on the cover of the November 1972 issue of Ebony magazine as she swayed her hips and threw her arms in the air while wearing a shimmering silver floor-length gown that perfectly skimmed her lean frame as she channeled Billie Holiday, the subject of her latest movie, Lady Sings the Blues. But just above her fingertips, in the small, bold white print, was a devastating subtitle. The Tuskegee study condemned to die for science. In a sharp contrast from the cover star's energy, a heinous story of governmental abuse was being laid out for Black readers across the nation, more than 3 months after Associated Press investigative reporter Jean Heller broke the story about the U.S. Public Health Service study of untreated syphilis at Tuskegee. Inside the issue, Ebony magazine writer Jack Slater filled 8 pages by delving into the distorted beliefs held by the founders of the study and the troubling impact it had on the people and the community of Macon County, Alabama. But Slater framed the story differently from other reporters at the time. He opened his piece by highlighting Charles Pollard, then a 66-year-old farmer in Macon County, Alabama, who had been subjected to the study and was one of 74 survivors out of the original 600 men. He described Pollard's disposition and his personality. By doing so, he painted Pollard in human terms, writing that he was a reserved, very patient, very polite man who embodies great gentleness. That description was non-existent in the National Archives, and there was nothing mentioned about Charles Pollard's gentle demeanor in his interview with the New York Times in July 1972 either. This intimate picture of who he was, separate and apart from what happened to him, is glaringly omitted in those places, and it signals that it wasn't of importance until Pollard spoke to the Ebony magazine reporter. One of the thousands of Black readers who picked up the November 1972 issue of Ebony magazine was Wallace Tyson, then a U.S. Air Force service member based in Texas. Wallace was also the son of Freddie Lee Tyson, a 67-year-old carpenter and sharecropper from Tuskegee, Alabama, who did not know about the study or his participation in it. After reading Ebony, Wallace called his father to ask about the study, and I was able to sit down with his younger sister, Joyce Tyson Christian, a retired nurse and U.S. Air Force veteran, who recalled their conversation in late 1972.
My brother Wallace was out in Texas and he was reading Ebony magazine and he saw where they talked about this study. To call my dad and he says, Daddy, do you know anything about this study? He says, No, I don't remember anything about any study. What ended up happening about a couple of weeks or so later, we got a call from the government. They said that his name was on the list and they needed to do a medical workup on him.
All of this was a surprise to the Tyson family, and it was a surprise that they did not discuss as a family.
But it wasn't much discussion because my parents didn't discuss things like that. We were just not, sexual things like that. It was just not a thing that they talked about around their kids. But we really didn't discuss it as a family. No, no.
The decision to not discuss the study in depth aligned with how the Tyson family operated. Love, family, and community always came first. And that was the way of things for as long as Joyce could remember. She was the youngest of the 9 Tyson children. And starting from her first memories of her father, Freddie Lee Tyson, that was how their lives flowed.
My earliest memory of my dad was when I was like very small, or maybe around 3 or 4, when he used to get us on his knee and, do the horse thing, jump up and down. And he loved his family. He loved his family. My father was bent on building us a house. So he built us a shotgun house, and we had a basement, but he never finished it. But it was a wonderful environment for all of us to be there and to live in that house. We all lived on a relative hill. It was called Neal's Hill because we didn't have very much money at all. But we didn't know that. We were so happy with being just there. We grew up on a farm. We had farm animals. We had chickens. We had a goat, and we had a mule. At one time, we had a donkey, but we rode that donkey so hard he escaped that night and went back home. But living in our house was a wonderful thing, and all of our cousins would come to our house and eat because my mother loved to cook, and she was a great cook.
That wonderful life was cultivated in part by her father's calm, kind presence, which essentially set the tone for the family.
My father was a very soft-spoken, very kind, very generous, and he also liked to fish. And most importantly, he liked to play around with his children and giving them peppermint candy. I remember growing up, and he would have those big old sticks of peppermint candy, and he continued that ritual through to his grandchildren. They are always fishing in his overalls. He was famous for his overalls. We were digging his pockets looking for candy. They still did it when he was older. He also was a leader. He was in his church. In the church, he was a deacon in the church. He would sit on the morning bench and he would sing. And my mother was the choir director, and she had a very high soprano voice. My mom's name was Jenny Mae Neal Tyson. And I have to speak of my mother because she was so much a part of his life. They were such a loving couple and such a wonderful couple to be together. They were married for over 50 some odd years. I think they married like a year or so after that study had started. Yeah.
Freddie Lee Tyson was also famous for his dancing skills and piano playing.
Well, he loved to dance, and he had this dance called the trigger toe. We never really, I don't know if I ever learned it, but he would get out there and he would cut the mustard. He was a sharp dresser, and he would cut the mustard with that trigger toe. And it was so much fun because when I was in my junior year in high school, we had a father-daughter dance at our school, and he was my date. And we danced, and he did the trigger toe, and it was so much fun. And he also liked to play the piano, the boogie woogie. He called it the boogie woogie. And he just loved doing that. And we had an upright piano in our house when we moved in Waterbury. And he would get on it and play the boogie woogie on it.
Tyson was a man of many talents. He was a gifted farmer, carpenter, dancer, singer, and piano player. And he used his many skills in his community, even contributing to historic projects.
My father was a great farmer. He was a sharecropper. He started out as a sharecropper on the Youngblood place. And that's where my mother met him, up in Little, Texas. And they lived on Youngblood's place for a while, and then they got their own place. He bought some land, and we had about 2 acres or so of land, and that's where he put the house. And also, he did several different jobs. He worked for the forest, the National Forest Service there outside of Tuskegee. He worked as a fireman on the base. He helped to build the Tuskegee Airmen's base out there. And then he also built the school that I went to, our grammar school. My brother and I, my sister Lily, we went there. My sister Barbara, she also went there for a while.
The airfield that Joyce briefly referred to is Moton Field in Tuskegee, Alabama, where more than 15,000 Black U.S. Army Air Corps service members worked as engineers, mechanics, pilots, instructors, navigators, bombardiers, flight crew members, and support staff in the military experiment to test whether or not Black people could lead, fly, and maintain combat aircraft for combat missions. It's not lost on me how multiple U.S. government experiments impacted Freddie Lee Tyson's life, or the fact that these tests were established with no intention from the federal government of aiding or helping Black people. As Joyce mentioned, her family ultimately moved to Waterbury, Connecticut after she finished grade school. But years before they left Alabama, Freddie Lee Tyson left the U.S. public health study and sought medical care separate and apart from the government nurses and physicians who would visit him each year during the U.S. Public Health Service roundups.
He got out of the study. I didn't mention that. He got out of that study very early on because my grandmother on my mother's side was a midwife. She had gone to Tuskegee and gotten her midwife certificate. And she told him to get out of that study, Fred, and go and see a doctor. And he did.
And what do you think tipped her off?
I don't know. I don't know why. But she was just a smart woman herself. I guess maybe she might have seen something or heard something when she was out amongst the people, when she was doing her midwifery stuff, I don't know. I can't answer that question.
Do you have any understanding of the date or the year in which he left the study?
I don't think he was in it for very long. Maybe 3 years, maybe, or less.
While it's unclear what prompted Freddie Lee's mother-in-law to tell him to stop engaging with the U.S. Public Health Service and their medical teams, she knew that it felt wrong, and she spoke up and intervened. It wasn't until late 1972 that Freddie Lee's son called him about the Ebony magazine write-up on the study, and the U.S. Public Health Service re-entered his life, confirming that his name was on the list of participants and requesting a full medical workup.
Now, my father had congenital syphilis, but it didn't pass on to us because we had to have tests done. Each one of us had to have a test done after they came out with the disclosure of it. My father was tested, my mother was tested, and my mother never wanted to talk about anything related to that study. Never. She never would. And she denied. She was almost like in denial. Yeah.
When you mention your mother being in denial, do you think that's an explicit generational reality?
Yeah, I think that was the way she was raised. And she just didn't want to talk about such things.
This sentiment of denial or shame about being attached to the study was not unique to Joyce's mother, Johnny Mae, either. In the Voices of Tuskegee Study short documentary produced by the Tuskegee History Center in 2002, Albert Julks, the son and nephew of 3 men subjected to the study, shared that one of his uncles felt shame when the study was publicly exposed.
Uncle Warren spoke very little, about the study itself, and he did not feel that he was dealt with justly. because he felt it's like he was cheated through trickery. Then he felt bad because for others to know that he was that ignorant to be a participant hurt him.
Over time, that shame has been replaced with public education and advocacy efforts, and Joyce Tyson Christian was clear that her father continues to inspire her efforts today.
And my father had this saying, well, and he told my sister, he says, well, baby, I can't do anything about this now, but you can. You can do something about it. You can never let this happen again. And that's what our Voices of Fathers Legacy Foundation is doing right now.
Voices of Our Fathers Legacy Foundation is dedicated to preserving history and the legacies of the 600 African American men victimized and unethically treated in the U.S. Public Health Service study of untreated syphilis at Tuskegee. The organization was founded in 2010 when the children and descendants of the men subjected to the study united and committed to telling their fathers' stories.
Having a kinship or a brotherhood or a sisterhood amongst the descendants has really helped a lot of descendants come out.
As the descendants developed their work, the COVID-19 pandemic prompted the foundation to engage in public education and public health advocacy efforts surrounding the COVID-19 vaccine rollout.
There has been a lot of references to the study as to why some people may or may not want to take the vaccine. A lot of misinformation is out there. We have the ability to find out the facts.
That was one of the things that blew up the foundation. When COVID came out, they had all these misconceptions about the men had been given syphilis shots, and that's how they got syphilis. Well, the men already had the syphilis that was already there, but they didn't treat them. That was the main thing. They didn't treat them. And they did unethical things like bowel specimens, spinal taps, and all of that without giving them any anesthesia and all of that. And when penicillin came available in 1945, they didn't offer that to those people.
In addition to dispelling the myths, the foundation encouraged the public to take the COVID vaccines throughout the pandemic. And since 2017, they have awarded a total of $79,000 in scholarships to descendants with the intention of lifting up 625 new voices in the fields of bioethics and health sciences, and expanding the ethics of care with support from the Milbank Memorial Fund and the CDC Foundation. You may recognize the name Milbank because this was the fund that provided the resources for the autopsies conducted by the U.S. Public Health Service throughout the study. Joyce shared that as the foundation was advocating for the COVID vaccine during the pandemic, the Milbank Memorial Fund reached out to them.
People started coming out of the woodwork, like Milbank, who wanted to apologize for what their part had been in supporting the autopsies they did, and they gave money to Tuskegee for things that were going on down there.
How did you react to Milbank reaching out to you all?
Well, my sister told him, it sounds like, Chris, you're giving us a confession. That's what she told him. But anyways, I thought it was a stupendous outreach of regret as to what had happened in the past, because they weren't part of that, but it was regret for what had happened with their foundation. So that's why they came out and they apologized, and it was a lot of regret that they understood that it was wrong what they had done, even just giving money for the autopsies. We accepted that because, hey, that's what's wrong with the world right now. People are hating each other because of wrongs done in the past, and that's why we don't have any peace.
For more information about the Voices of Our Fathers Legacy Foundation, visit voicesforfathers.org. Thank you for listening to Archival, and thank you to Joyce Tyson Christian for being open and candid during our conversation. I am beyond honored to have learned about your father, Freddie Lee Tyson, and your family. And a special thanks to your sister, Lily Tyson Head, for connecting us. I hope that the 2 episodes related to family archives and the human beings impacted by the U.S. Public Health Service study of untreated syphilis at Tuskegee have given you a small glimpse into their lives and filled in some of the gaps in the archives. On the next episode of Archival, we'll turn to a few of my experiences and findings from FBI records, also known as the Vault. Subscribe wherever you get your podcasts so you don't miss a single episode. Archival is a production of J. Tolliver Media, LLC.